hit the record button. All right. Welcome to our 12th continuing education program on special care dentistry in collaboration with the New York State OPWDD Task Force on Special Needs Dentistry. Some brief introductions. Dean Myers, the Dean of Touro College of Dental Medicine, is unable to be here today, but he sends his support and has been a wonderful supporter of this CE series. I also have here Dr. Susan DeCenso, who is on the call or on the webinar. She is the Director of Special Needs and the co-director of the Touro College of Dental Medicine Fellowship to Address Oral Health Disparities. And myself, Dr. Raquel Rozdolski, Director of Anesthesia, and co-director with Dr. DeCenso for our fellowship and the chair of the Dental Health Planning and Hospital Dentistry Committee. So we do offer these CEs free of charge, and we're very happy to do that. We find this information to be incredibly valuable, and we want to get out as much information and support of this population as possible. But we do want to mention that there's always an opportunity to donate. You can make non-taxable donations to support Touro Cares. And if you haven't heard about Touro Cares yet, Touro Cares is the Center for Access, Respect, Empathy, and Social Justice that's going to provide individuals with physical, emotional, and intellectual developmental disabilities a unique clinical environment that specializes in providing oral health care to a population with limited or no access to dental care. With your support, Touro Cares will become a reality and fill this incredibly critical need to service a marginalized portion of our community. We look forward to opening our doors, but we can't do that without your help. So thank you for considering, and we look forward to sharing more about Touro Cares with all of you. I also want to mention our fellowship to address oral health disparities. Touro is proud to have had and currently has a fellow. We've had 2 fellows go through our Touro College of Dental Medicine program. It's a wonderful fellowship that provides direct patient care and servicing people with IDD under the supervision of experienced dental faculty members. Our goal is to increase the number of providers in New York State that are competently, confidently, and compassionately treating these patients with IDD. We currently have open applications for our next round of fellows. And if you know anybody that might be interested, or if you are on this call and you are interested, please reach out to Dr. DeCenso and myself, and we'd be more than happy to give more information about the program and connect you with our current fellow, Dr. Marie Robles. And we couldn't do this without all of you. I wish I could list and mention each one of you individually, but we are so grateful for your support. It truly takes a village, and we are very grateful for everything each and every one of you, and so many of you that aren't listed on here, does to support us in our mission for more compassionate care for all. And now I bring us to the main event, navigating oral hygiene, sensory processing sensitivities, and autism, breaking down barriers by Gina Williamson. Gina is a marvelous individual. She is a collaborative partner and turned friend to Dr. DeCenso and myself. So I am very much looking forward to her lecture here today, and I'm going to hand it over to Dr. DeCenso to do the honors of formally introducing you all to Gina.
Thank you. Welcome to everyone, and welcome to our guest speaker, Gina Williamson. Gina is the Director of Children's Services at Anderson Center for Autism. graduate of Purdue University with a bachelor's in nursing science. Ms. Williamson received an associate's degree from Dutchess Community College and worked as a dialysis nurse for the early part of her career. With an extensive background in human services, 8 years ago, Ms. Williamson joined Anderson Center for Autism's team as the children's nurse supervisor, which led to a role as health services coordinator, a well-deserved promotion to director of health and related services, and ultimately received a promotion to her current position of director of children's services. She believes in transformational leadership, inspiring and motivating her team as they work together to develop and carry out services that support the well-being of people with autism. Ms. Williamson is currently pursuing a doctorate in nursing at Capella University. And Dr. Rozdolski and I can certainly speak to Ms. Williamson's transformational leadership approach. She reached out to us several years ago now at this point and has been instrumental in developing an affiliation between our school and Anderson Center. And we look forward to a very prosperous relationship that will foster assisting access to care issues, improved oral hygiene for individuals with autism, and improving the education across the board for our pre-doctoral students as well as postdoctorate. So with that, I will pass you the baton, Ms. Williamson, and thank you so much for being here.
Well, thank you so much for that wonderful introduction. Please bear with me as I share my screen here and try to get this going. I am a nurse. I am not very tech savvy, but we will make this work the best that we can. So I actually have to get into something called Slido because we're going to have some questions that we're going to have you answer this evening. So let me do that now. Can everybody see that? Can somebody just let me know if they're seeing the QR code for Slido?
We can see it.
Okay, so again, thank you for having me this evening. It's very exciting for me to be here. As Susan and Raquel had explained, I reached out in 2022 and getting my master's degree. I was working on my practicum. I was up late one night and I came across this wonderful article about Smiles United. And as I was reading it, I didn't, realize or process that this was actually taking place somewhere feasible, something tangible that we could get to in Westchester County. So when I realized it was, I got very excited, reached out to them. They have been welcoming and warm. They've been a godsend to our agency. So we are proud to support in any way possible Touro. So if you can tonight, as I stated, we are going to use Slido. If you can take a picture of this QR code, we are going to be using this to answer some questions. And this is our first question. So have you had the opportunity to work with individuals with autism during your time as a dental student or in your professional practice? So we'll just give a few more seconds to see if anybody else responds. So far, it's 100% yes, and that's great to hear. So now we're going to go to the actual presentation. So again, as they stated, which let me just get my speaker's notes up. Okay, as they stated, we are going to be discussing sensory processing sensitivities and autism, breaking down barriers. So we're going to discuss strategies to overcome oral health obstacles experienced by individuals with autism, as well as sensory sensitivities, sensory friendly techniques, and positive reinforcement. So some objectives we're going to learn tonight. We're going to have participants recognize common sensory sensitivities experienced by individuals with autism during oral hygiene routines. You will acquire knowledge of sensory friendly strategies to address oral hygiene challenges in autism. And you will learn effective strategies for utilizing positive reinforcement techniques to facilitate a successful dental visit for individuals with autism. So understanding the growing prevalence of autism. Currently, the statistics we have are that 1 in 36 children are now being diagnosed with autism. The increased prevalence underscores the importance of addressing the unique oral care needs of individuals with autism. A little bit more about the discovery of autism. So, sorry, my speaker's notes went away. We do have the term was first coined in 1910, and in 1943, it was identified, autism was identified distinctly as a developmental disability. So we're going to play a little video about applied behavior analysis. We use a lot of applied behavior analysis at Anderson. We utilize this in our practice on a daily basis. And for some of you who are familiar with what applied behavior analysis is, this will be a refresher. And for those of you who are not, you will gain some knowledge.
You know what applied behavioral analysis is? Known as ABA for short, it is the evidence-based treatment for autism and is thoroughly research-based with over 1,000 journal articles supporting it. ABA has been endorsed by the U.S. Surgeon General, the New York State Department of Health, as well as the National Standards Project by the National Autism Center in the U.S. Additionally, 40 states in the U.S. have state funding or insurance coverage for the treatment of ABA for children with autism. Studies show that almost 50% of children with autism who receive good quality intensive ABA at an early age will be able to catch up in development to their typical age. So how does ABA work? Firstly, ABA is based on the principles of operant conditioning. Essentially, that means that whatever behaviors that we reward or give attention to will increase. This includes both appropriate and inappropriate behaviors. For example, book. You want the book? Here you go. This is an appropriate behavior of communication, and the reinforcement in this case was the book the child requested for. So it is likely that the appropriate behavior of using words to communicate will increase. Book. No book. We gotta do work first. Book. Okay. Here you go. However, in this situation, the inappropriate behavior of shouting and pushing around was reinforced. Therefore, it is likely that this inappropriate behavior will increase. Secondly, ABA is a teaching methodology. ABA trained professionals to utilize basic curriculums, but depending on the severity of autism, some children may not finish the syllabus. They may need it to be simplified even more in a unique and individualized program that is tailored to each child. Over our last 10 years of experience, we have found that the principles of ABA can be applied to children of all ages and even adults with or without autism. This is because complex skills like language, play skills, and even social skills can be broken down to its component parts and then paired with positive reinforcement or reward. For each layer of learning, children at young ages can receive external rewards of their preference like their favorite toys. But over time, reinforcements can be more internally rewarding, like praises or high fives. Having sufficient practice can establish the skills over time and across different environments. In summary, ABA principles boil down to number 1, breaking complex skills down to its basic parts. Number 2, pairing this with positive reinforcement. And number 3, providing sufficient practice. As a closing tip, remember that whatever behavior that you give attention to will increase. Do give us a call if you have any.
Okay, so that was a little bit about ABA. One thing I do want to mention, at Anderson Center for Autism, we do serve profoundly autistic individuals across the children's program and adult program that we have. So when you are working with individuals who have autism, they are on a spectrum. So you might have an individual that can come to you and is fully communicative with words, and most people might not even know that the individual is autistic. They might just have some social anxieties or barriers related to social skills. However, individuals that are coming from Anderson Center for Autism, you can clearly see that they do not have much verbal language. They use PEX boards, they use iPads. So it can be quite difficult for our individuals, especially since a lot of them will have behavioral issues, self-injurious behavior, so on and so forth. And that's why having these type of webinars is good to learn about the different spectrum, the different array on the spectrum, and what the individuals we serve are profoundly autistic. So incorporating applied behavior analysis in dental care. So we're going to look at utilizing positive reinforcement, which you just heard in the video, to encourage good oral hygiene habits, as well as sensory-friendly care techniques and communication strategies to facilitate dental care for the population. So oral health care conditions and autism. Obviously, you guys are well aware of these conditions, so we will not be going over what they are. You see them across the children and adult span, but why are oral health conditions so prevalent in this population? So due to oral sensory processing differences, many individuals with autism have experience with difficulty experiencing sensory processing, which include heightened sensitivity to certain textures, tastes, and sensations, making it challenging for them to tolerate ADL such as toothbrushing, flossing, and other oral hygiene practices, leading to an increased risk of plaque buildup, cavities, and gum disease. Communication and social interactions, as we just discussed, are often difficult for this population. Some individuals with autism may have difficulty expressing their dental concerns or understanding oral hygiene instructions, making it harder for them to maintain good oral health habits and seek appropriate dental care. Behavioral issues such as repetitive behaviors, difficulty with transitions, and sensory-seeking behaviors can interfere with oral hygiene practices and dental visits. Some individuals with autism may engage in self-injurious behavior that can affect their oral health, such as tooth grinding or chewing on non-food items known as pica. Many individuals with autism have selective eating habits or preferences for certain textures or flavors of food, which can lead to a diet that is high in carbohydrates or sugary foods, increasing the risk of dental decay and cavities. And additionally, some individuals with autism may have co-occurring medical conditions or take medications that affect their oral health. For example, medications that cause dry mouth can increase the risk of tooth decay, while conditions such as gastro and esophageal reflux disease, GERD, can contribute to enamel erosion. So I do want to also touch base on GERD. In our population, one behavior that we do see quite often and is very perplexing and hard for us to help modify is rumination. So a lot of times we will have individuals who ruminate as a behavior and as such have a lot of erosion. And I think that's important for providers to be aware of, that sometimes it's not a medical condition, yet a behavioral one. There are barriers to accessing dental care, including transportation challenges, financial constraints, and the lack of dental providers trained in accommodating their needs. So one area that I have been working on and talking to Susan and Raquel about is the fact that there are no ICD-10 codes for desensitization. So anytime we've tried to work with dental providers to desensitize our population, it hasn't worked out because they're unable to bill for that. So we have tried to do some in-house desensitization, but again, not having the proper tools and techniques to simulate a dental office, it hasn't really been successful. So those are some things that we're looking to work on in the future, hopefully with Touro. So again, this can result in delayed or infrequent dental visits, allowing for dental issues to progress untreated. So we have some common challenges for individuals with autism and oral care. So again, as we explained earlier, sensory sensitivities, communication barriers, anxiety, and the sense of overwhelm. This is very big for our population, and routine disruptions. The autism population are very set in their routines. So anytime we are going to take an individual for a dental appointment, we have to make sure that they are prepared for that. And that could be in the form of a social story. It could be in the form of being on their calendar. You have the dentist on this day, this time. Otherwise, it could cause a significant behavior if they are unaware or their routine is disrupted. So I'm going to briefly show you this video. This is through the eyes of a child who has autism. In the beginning, the sound isn't on for a few seconds, so bear with me as that comes on, but here you go.
One, 2, 3, 4, 5, 6, 7, 8, 9. Shake my hand. I'm not naughty. I'm autistic. And I just get too much information.
So I hope you were able to hear that video. And, you know, I would love to hear feedback, but right now we're in the middle of the webinar. That is, when I first saw that video, it was very impactful to me. To just think about that child was in the mall with their parents. So think about, put yourself in that child's shoes and be in the dental setting. There's lots of sounds, drills, bright lights, TVs, staff, other patients. It can be very overwhelming. Sound of the drills, sound of water running. It's a sensory overload for them. So it can be very overwhelming and invoke anxiety. So recognizing the triggers of sensory overload. So again, an unfamiliar environment, new sights and smells in dental offices, bright lights, sensory discomfort from fluorescent or bright dental office lighting, textural sensitivities, discomfort with the feel of dental instruments, loud sounds, which can trigger anxiety. So what can be done in the dental office to reduce sensory overload? So using soft, non-glaring lights to create a calming environment, minimize noise by using sound-absorbing materials or playing soothing music with noise-canceling headphones available, provide weighted blankets or lap pads to offer gentle pressure, which can help individuals with autism feel more grounded and calm, and offer sunglasses or tinted glasses to reduce visual stimuli. Use non-toxic, neutral smelling cleaning products to minimize strong odors. So visual supports. So using visual supports or social stories to outline steps of oral care routines. Visual timers can help individuals anticipate the duration of the procedure. So again, consistently talking to the individuals, letting them know what is going to happen next, giving them time frames, having a visual timer can help keep someone calm. Gradual desensitization, so introduce oral care tools and routines gradually, allowing time for acclimation. Start with gentle, non-threatening activities before progressing to more intense oral care. And again, positive reinforcement, which is kind of the main star of this presentation. So implement a system of positive reinforcement to encourage participation and cooperation during oral care. Offer rewards such as stickers, praise, or preferred activities for completing oral hygiene tasks. So we're going to do a quiz, and if everybody has their QR code set, you should be all set for this. So you have 40 seconds. During a dental appointment, which loud noise might trigger discomfort in individuals with autism? Okay, so 100% of you said the sound of the dental drill, and 100% of you were correct. The sound of a dental drill, it gets to my soul as well. So it would definitely get to the soul of an individual who has some sensory sensitivity issues. So what role can dental professionals play? Obviously, you all play a critical role in supporting individuals with autism and maintaining good oral health. So here's what you can do. You can understand the sensory sensitivity of the individuals with autism and adapt dental procedures accordingly. You can provide a sensory-friendly environment in the dental office, such as dimming lights and quiet waiting areas. You can communicate with caregivers to gather information about the individual's sensory preferences and challenges. So we're going to stop there for 1 second. And I think this is one piece that lacks when it comes to scheduling appointments for these individuals. I did share something with Susan and Raquel a few weeks or about a month ago about a parent who went to a dental appointment, and this office said they specialized in IDD care. And when they got there, everything was taking a very long time to get through. They had the assistant asking many questions while the child was in the chair. That took too long. So it ended up in being an unsuccessful visit because the individual was unable to tolerate sitting in the chair for as long as they did. So I think when you're talking about communicating with caregivers, I don't know if there's any possible way in the office prior to that maybe you can have someone speak to either the caregiver or the parent to find out if there are preferences, what their sensitivities are, or what needs they may have. Because again, autism is not blanketed, it's individualized. So understanding each person and their needs is imperative. You can educate caregivers about the importance of oral hygiene and provide tailored strategies for home care. I find this even more important in the very young population, toddlers. Parents, when they first have a diagnosis of autism, oftentimes are so overwhelmed with so many other bits of information and systems that they have to go through and things that they have to do that oral care may be overlooked. So I think having those conversations with parents early on is imperative. You can offer accommodations during dental appointments, such as allowing breaks or providing sensory tools like weighted blankets or fidget toys. You can use alternate techniques for oral examinations and treatments, such as tell, show, do. That is very effective. You tell what you're going to do. You give the example by showing on yourself or someone else, and then you do it. Collaborate with behavioral therapists or autism specialists to develop individualized behavior plans for dental visits. And you can attend trainings and workshops to increase awareness and sensitivity to the needs of patients with autism. So we're going to do another quiz. Here you go. Okay, so the question, what are some sensory-friendly oral hygiene strategies? Please choose all that apply. Okay, so 88% of you said the use of visual supports. 75 said acclimating an individual gradually to dental tools, and 13% said start a dental visit with the most invasive procedure. So the correct answers are the use of visual supports and acclimating an individual gradually to dental tools. You wouldn't want to start a dental visit with the most invasive procedure. You want to work gradually into that. So here we have another quiz. Okay, so the question was, please select all that apply. What are examples of a sensory-friendly environment in a dental office? 100% of you said dimmed lights, and 100% of you said quiet waiting area. And 100% of you were correct. Sorry. So communication impairments in a dental office for nonverbal autistic individuals. So nonverbal individuals with autism may struggle to express pain or discomfort. They might have difficulty in conveying oral pain or understanding dental instructions. And they might be overwhelmed by unfamiliar sensory stimuli, leading to communication challenges. So we're doing it again. We have another quiz. So the question asks, which environmental factor is most commonly associated with sensory sensitivities during a dental visit that can be particularly distressing for individuals with autism due to their sensitivity? 75% said the sight of bright overhead lights, and 25% said the sensation of dental tools in the mouth. And those are all very relevant. The correct answer for this particular one is the sight of bright overhead lights. But another selection, which 25% of you chose, was the sensation of the dental tools in the mouth can also be considered. But for this one, we were going with the sight of the bright overhead lights. So, sorry guys. Just every time we go in that, it takes away my presenter's view. Okay. So using picture exchange communication systems, also known as PECS. The Picture Exchange Communication System, PECS, is a valuable tool to help nonverbal individuals with autism communicate their needs and feelings. PECS uses visual support, such as images and symbols, to enhance understanding and comfort in dental settings. So we use the PECS system a lot for our individuals at our site in our nurses clinic. If individuals are nonverbal and they do not have an iPad or some type of electronic device, we typically use the PECS system to find out what the problem or issue might be. Again, iPad for communication in the dental setting. iPads can display images and symbols to add in communication. Interactive apps on the iPad can help individuals express their needs, and iPads allow for personalized communication boards and visual schedules. So again, this is not something you would provide. This is something that the individual and their caregiver or family member would be providing and bringing to the visit. So dental staff should use clear, simple language and visible supports, such as pictures or diagrams, to explain procedures and expectations, allow extra time for appointments to accommodate potential communication challenges and sensory sensitivities, and provide a designated quiet space where individuals can take breaks if they become overwhelmed. Offer social stories or visual schedules in advance to help prepare individuals for their dental visit and reduce anxiety. Typically, that last piece of offering social stories and visual schedules would be done by the caregiver or parents. So again, importance of using parent and caregiver knowledge for successful dental exams. As we stated, everyone has unique knowledge of their child's sensitivities and triggers or communication styles. So incorporating this into booking the appointment. If you have an established patient, then you would already know what their requirements are, what their needs are. If you do not, taking the extra time to find out if there's any challenges they may have or anything that you can do to accommodate the appointment, I think would make the appointment move more efficiently. And the importance of dental provider knowledge of autism and oral care. So Caregivers need to understand the specific oral care needs of individuals with autism. That's very important. Sometimes I think that is greatly overlooked. Applying techniques to make oral care comfortable and sensory friendly for the individual, and establishing and maintaining a consistent routine for better outcomes. So enhancing oral care outcomes. And here we're going to start talking about positive reinforcement, which leads to comfort and trust, and which will lead to consistent oral care. Positive reinforcement for enhanced oral care. Positive reinforcement in dental care involves using rewards or praise to encourage desirable behaviors and increase the likelihood that those behaviors will be repeated in the future. In the context of dental care, positive reinforcement can be used to encourage individuals, especially children or individuals with special needs like autism, to engage in oral hygiene practices, cooperating during dental appointments, and maintain good oral health habits. Overall, positive reinforcement techniques in dental care aim to create a supportive and encouraging environment that promotes cooperation, reduces anxiety, and fosters a positive attitude towards oral health maintenance. By reinforcing desirable behaviors, dental providers can help individuals develop lifelong oral hygiene habits and build positive associations with dental care. So, benefits of positive reinforcement. You boost confidence, which encourages feelings of accomplishment, leading to enhanced self-confidence. Behavioral improvements can lead to positive changes in behavior and compliance with oral care routines. And emotional support. It provides emotional support and comfort during oral hygiene activities. So we have a quick video on positive reinforcement.
Positive reinforcements means things that we do after a behavior to make it more likely that that behavior will occur again.
Very good. Put it over here.
They include things like smiling at our kids, or giving them our full attention, or giving them a hug. They can also include things like stickers, or points, or a special prize after they've done something nice. It's easy to notice when our children are misbehaving, but we need to make a conscious effort to notice when our children are doing it right. This is what teaches them the right way to behave. Let's say you want your child to do a better job picking up. Well, there's two possible approaches. You can yell at them for leaving such a mess all the time, but that's not going to inspire your child to start picking up. If you notice when they pick up a little bit and you said, "Oh, thank you so much, that's really helpful," that's going to inspire your child to do even more picking up. The best kinds of praise for children are the ones that tap into the core components of self-esteem.
Yeah.
Good job.
Nice work.
So we might say to a child, "You worked really hard on this," or "You did it." We can also talk about their impact on other people. We can say, "I really enjoyed hearing you sing," or "That was a very kind thing you did for Sam." A lot of parents wonder about using a good behavior chart. These can be useful for getting over a hump kind of behaviors. Now, we want to be careful not to overuse good behavior charts because they can set up a really unattractive pattern where our children ask us, "So what do I get if I do that?" In general, I prefer natural kinds of positive reinforcement: a smile, a hug, and extra attention, or even some extra privilege that they've earned.
So there's a little bit about positive reinforcement. Currently at our practice, we are in the process. I am, as Susan had mentioned, getting my doctorate. And as a part of my quality improvement project, we are using positive reinforcement to see what effects it has on toothbrushing. So we do have a lot of individuals who have quite a bit of difficulty even tolerating toothbrushing. So we have selected a number of individuals, and our nursing department as well as our behavioral services department are working with our staff during toothbrushing time to see if the use of positive reinforcement will be effective on toothbrushing. And I have to say that one individual that was not tolerating a toothbrush at all has actually tolerated a toothbrush in their mouth for 20 seconds. And that might not seem like much because we really want them to be able to brush their teeth for 2 full minutes, but that's a huge step for us. So we're pairing something that that individual really desires or wants with toothbrushing, and we're giving positive reinforcement surrounding that. And so far we have been seeing some pretty good results with that. So again, encouragement, providing positive affirmations and encouragement for positive oral care behavior, reward system, implementing a tangible reward system to reinforce consistent oral care practices, and celebrating progress. You always want to celebrate milestones and progress in oral routine care to promote positive reinforcement. So we're going to have another quiz. So the question is, what are examples of positive reinforcement after a successful dental visit? Please choose all that apply. And 100% of you said offering a reward with a sticker, and 100% said rewarding the child with a preferred activity. And you would be 100% correct. So we have another quiz. So the question for this was, how many participants in tonight's webinar have successfully incorporated the use of positive reinforcement in their practice? And 100% of you said that you have. So strategies for using reinforcement. Before the dental visit, communicate the expected behaviors and routine using visual supports or social stories. Again, that would be on the parent or the caregiver. Ensure the individual understands what behaviors will be rewarded. Again, will typically fall on the caregiver and or the parent. However, it would be good for them to share with the staff so the staff can help promote that. Begin by reinforcing small steps or successes. This could be as simple as sitting calmly in the dental chair or allowing the dentist to briefly examine their teeth. Gradually increase the expectations over time. Identify rewards that are highly motivating for the individual, such as stickers, tokens, favorite toys, or activities. Let the individual choose their preferred reward to increase its effectiveness. Provide immediate feedback. Immediate feedback is imperative. And reinforcement following the desired behavior. This helps the individual make the connection between their actions and the reward. Look for opportunities to reinforce positive behaviors as they occur, even if they are small. This reinforces the behavior and encourages repetition. Use verbal praise and encouragement to acknowledge and reinforce desired behaviors. Be specific in your praise, highlighting the behavior you want to reinforce. Implement visual reinforcement systems such as token boards or reward charts to track progress and provide visual feedback on the individual's accomplishment. So this might be something that the parent or the caregiver brings back and forth between visits. And again, as I stated earlier with the example that we're doing at my practice site, pairing rewards with dental procedures to create positive associations. You want there to be positive associations. And what we do practice is if an individual is not in the mood to continue with that session, we are not going to force them because we do not want to pair any negative examples to oral hygiene. So again, for example, offer a preferred reward immediately following a successful dental exam or procedure. And by implementing these strategies, dental professionals can create a positive and supportive environment that encourages cooperation and reduces anxiety for individuals with autism during dental visits. So sensory-friendly oral care products. We have gentle toothbrushes, soft and sensory-friendly toothbrushes designed for individuals with autism, flavor-free toothpaste. So it's sensory neutral toothpaste options suitable for individuals with sensory sensitivities. And soothing mouthwashes. Mouthwashes formulated to be calming and sensory friendly for oral care routines. So examples of oral care products that may not be considered sensory friendly for individuals with autism include hard or abrasive bristles, can be uncomfortable or painful for individuals with sensory sensitivities. Electric toothbrushes with intense vibrations or loud noises may be overwhelming for some individuals with autism. Again, it states some. There are some individuals that do very well with electric toothbrushes. Oral care products with strong fragrances can be overwhelming for individuals with sensory sensitivities, making it difficult for them to tolerate oral care routines. And oral rinses or mouthwashes with a strong burning sensation may be intolerable for individuals with sensory sensitivities. Dental floss that's too thick or wax texture may be uncomfortable to use, leading to aversions to flossing. And it's, again, important to consider the individual preferences and sensitivities. Some of these things may not bother everyone. It is not a blanket. It's not one size fits all. So examples of oral care products that may not be considered sensory friendly for individuals with autism, we went through that. And we went through the mouth rinses, and that's pretty much it. So again, we're going to do another quiz. So the question is, please select all that apply. What are some examples of sensory-friendly oral care products? 100% of you said soft bristle toothbrushes. 56% said toothbrushes with textured handles. And 100% said flavorless or mild flavored toothpaste. And you are correct. Those are the correct choices. Hard bristle toothbrushes and strong burning mouthwashes would not be advised. So, importance of consistent oral care routines for this population: establishing consistency. Consistent oral care routines play a significant role in managing sensory sensitivities. Effect on oral health: consistent good oral health impacts overall well-being and reduces oral health-related challenges, and it builds a positive association. So consistent care leads to forming positive associations. And we have, I think, one last question. So the question was, what are examples of positive reinforcement? A 100% of you said using preferred rewards. 6% said the use of timeout if the patient is uncooperative. 94% said praise and encouragement. 56% said immediate feedback. 88% said pair rewards with dental procedures and ignore, oops, we went too far. And 88, and I don't know if it's, I can't see what it says for ignoring, but the correct answers are pairing rewards with dental procedures, immediate feedback, praise and encouragement, and using preferred rewards. And whoever Robbie Peters is, you did a great job, it says, along with everybody else. Good job, everybody. So creating a structured routine. So what you see before you is a task analysis, and that's breaking down the steps of toothbrushing. So that is a part of the QI project that we're using at my practice site. It's a visual, and it helps the individuals to say, first, we're going to squeeze the toothpaste onto the toothbrush. Then we're going to hold the toothbrush under the tap. It's breaking things down into small little tasks. So creating a structured routine, so daily schedules, task assignments, and visual timetables are very helpful. Task analysis are crucial for various reasons. They break down complex tasks into smaller, manageable steps, making it easier for individuals to understand and learn. This is particularly important for individuals with autism to aid in processing complex information. Schedules and timetables are essential for autistic individuals for several reasons. They often thrive in a structured, predictable environment, as we spoke about before. Schedules and timetables provide a clear framework for daily activities, which can help reduce anxiety and provide a sense of stability and security. Visual schedules and timetables use symbols, pictures, or written words to represent tasks or activities, making it easier for autistic individuals to understand what is expected of them throughout the day. Again, as we stated, if routines are broken, it can create difficulties with transitioning between activities or changes in routine. So again, this is why schedules and timetables are so imperative. And they also help with skill development. Following a schedule or timetable encourages the development of executive functioning skills such as planning, organization, and time management. And then again, we talked about the collaborating with parents. So adjusting strategies based on the individual's needs and responses of the child, monitoring progress and adapting strategies, regular check-ins, conducting regular assessments to track the progress of oral care routines, and having adaptable approaches. So this brings me to the end of my slideshow. I really appreciate you guys taking the time to hear about the significance and importance of positive reinforcement, parent and caregiver communication, and the different strategies and techniques that can be used, which it sounds like you guys are using some of these because most of you said you have successfully incorporated positive reinforcement in your practice. The work that you do is imperative. There's a lot of work still to be done, even for doing my QI project, because I'm a nurse and I chose to do it on, the disparities in dental care for our individuals. Initially, they were telling me that this was not something that was acceptable because I'm a nurse, not a dentist. So I had to do a whole write-up and provide them with research to show them that if oral care isn't taken care of, then systemically throughout the body, you're going to have some major issues. Particularly for our older adults, we're looking at heart attack, stroke, etc. And for our young children, we are looking at them having increased incidences where they have to have extensive dental care or go under GA, which is the most restrictive. So I'm going to stop sharing my screen, but I wanted everybody to know that if you have any questions, my email address is gwilliamson@andersoncares.org. And we also have a consultation department, and it's called ACT. It's Anderson Center Consultation and Training. And I put Lisa Skaczynski's information up there. If there's anybody interested in having a training done at their practice site, you can reach out to Lisa. It is for a fee. Our consultation department does charge, but we want you to know that we're here to support you in any possible way, and we thank you for all that you're doing. Thank you for having me.
Thank you so much, Gina. If anybody does have questions at this current moment, we do have a Q&A that you can type your questions in. We'll give about a minute in case anyone does want to send any questions in. And I see some people are putting thank yous into the Slido that you had open.
I hope it wasn't too overwhelming with Slido. That was my first time using it. I knew I had to make something measurable, so I had to check your knowledge as we were going through, and everybody did a great job.
Let's see. Oh, yep, we got more thank yous coming in. Thank you to everyone for being here. Thank you so much to Gina Williamson for providing this excellent talk. A lot of great information and provided in evidence-based way and bite-sized pieces, which is very welcome to us. So thank you so very much. We look forward to continued collaborations between Anderson Center. Yep, lots of more thank yous coming in, Gina. So thank you so much. And to those of you who are looking for continuing education credit, you will be receiving an evaluation form. It's going to be sent to you. Just make sure you return it and you'll be able to get your CE credit as well. And thank you so much for everyone for being here. And I hope everyone has a wonderful night.
Thank you all. Thank you, Gina.
Welcome. Good night, everybody.
Good night.